Good morning. It is 9 o'clock, so we'll go ahead and get started. People will continue to join, and that is just fine. I'm Christy Ganya. I'm a program manager with Telehealth Rocks. And Telehealth Rocks is a federally funded program that focuses on school-based behavioral health. And we do this by working on social determinants, supporting school-based services, and telemetry trainings just like this one. We do have Telehealth Rocks team members, Sage Brown, Chase Koob, and Haley Bell here to help as well. They might be putting items in the chat or responding to questions or chiming in during the session, but feel free to reach out to any of us during the session if you need anything. We're glad you're here to discuss healthcare quality and access, and we've got just a few housekeeping items for you. This session is being recorded and we will send it to you afterwards. Your microphone has been muted, but feel free to unmute to ask questions or use the chat. It is very helpful if you have your first and last name visible on your Zoom screen or typed in the chat so that we can track attendance. We don't have any disclosures, and everything presented today is evidence-based and currently accepted within the profession. And then just a few reminders for after the session. We will share the slides and recording with you as soon as we can. Please just give us a little bit of time to get those processed and uploaded, and we'll send them out to you via email in the next couple of days. We will track attendance throughout the session, and we'll send certificates of attendance after the series ends. And then if you have any questions that you didn't get answered during the session or that come up later, feel free to email us anytime at telehealthrocks@kumc.edu. So we can get started. I'll hand it off to Evelyn and Robert.
Well, I'm really excited today to have two of my very favorite people in the world and two of the people that have done more for kids than anyone I know. Dr. Correll is turning off his camera because he's embarrassed, I'm sure. So Dr. Craig Correll is the superintendent of Coffeyville Public Schools. And Krista Postai is the CEO of Community Health Center of Southeast Kansas. I've known Krista forever, or a very long time. Sorry, Krista. She's so young, it's not forever. But I met Dr. Craig Correll when I moved to Coffeyville, Kansas to open a clinic, as well as a school clinic. So it was trial by fire, and he was the assistant superintendent. So really excited as we begin to think about healthcare access and quality, to talk about school-based health centers and talk to two people who have one of the oldest school-based clinics in Kansas and in Missouri, and one of the oldest rural-based school-based health centers in the country. Dr. Evelyn Nelson, who is the professor at KU Pediatrics and also the executive director for Telehealth Rocks, and I'm the program director for Telehealth Rocks. We'll talk a little bit about this social determinant of health and the impact both on health and on education of school-based clinics, and then we'll just try to spend as much time as possible just kind of talking with them and answering any questions you might have. So please feel free to put your questions in the chat as we go through this, and when we get to that section, we'll try to ask all of them. Next slide, please. So one of the things, just to kind of begin and start to think about what you want to know today and the kinds of questions that you have, that these two amazing people who are experts in this and have been doing it for over a decade now. So what's a question that you have that relates to how a school-based health clinic could both improve healthcare access in your community, but also the success of students in your school districts? Next slide, please. And please feel free to kind of put those questions in as we go through it and think about that, because we want to make sure we answer both the hows and whats and whys of everything today. So our objective today is to kind of talk about the healthcare access and quality domain, this area of the social determinants of health, really share how one healthcare organization and a school partnership have impacted the health needs of one community, Coffeyville, Kansas, as well as surrounding communities, and really think about what partnerships you might be able to make or might be able to better use to meet the needs of children and families in your community. And then just sort of encourage goal setting and quality improvement as you think around how to implement these types of things to help kids in your community. Next slide, please. So we talked about this in sort of the introductory session, but just as a reminder, and I know some of you may not have been there, social determinants of health are those personal, social, and environmental things that impact anyone's health, well-being, quality of life, and education success. So this is things like income and education level, jobs and benefits, resources, safety and security, healthcare availability, which we'll talk about a lot today, quality of your environment, and your relationships and social connections, which are very important for health. Next slide, please. So there are 5 areas of social determinants, and the one we're going to focus on today is healthcare access and quality. And these are those factors that relate to the healthcare you receive and how well it meets all of your physical and mental health needs. And we can see how that impacts school success, because a child that is sick or doesn't have their needs met or has behavioral and other mental health needs isn't going to be able to learn well in the classroom and be successful. Next slide, please. So your health is made up of lots of things beyond just the healthcare you receive. Um, when we talk about the CDC definition of health, that's a combination of physical, mental, emotional, and functional health, which is your essential for daily life, really makes up your health. And we know that 50% of our health is related to our community, and that even that 50% really directs things like your health behaviors and even your access to healthcare. Next slide, please. And I'll let Evelyn talk a little bit about sort of how education and health sort of impact and work with each other.
Thanks, Robert. This is a reminder slide from our first in this series. Just that idea that education and health go hand in hand. They're really in this series we're focused on as you enhance one or the other, you really help on both sides. So by placing health really convenient for the student and family. That then in turn helps with all the education indicators that you see there. So it's just really that idea that by helping one, you're almost always helping the other. And just also acknowledging some of the complexities and contextual factors that influence health and education, but really that idea that by helping one, you help the other.
Next slide, please, I think. So why is healthcare access and quality important for students? Well, accessible, high-quality healthcare. They have to have that to maintain their health and well-being. And one place that we know kids are is at school. And often, especially in rural communities, that school is the core of the community. So it makes a lot of sense to do things. One of the things we talk to school districts about and school nurses about, right, is this child lost their Medicaid. One of the benefits of a school-based health center is having someone that can work with families to get back on Medicaid and keep them on Medicaid and get their services met. And then things like poverty and the environment really do keep some families from having accessible and affordable healthcare services. So this is issues like providers that can take Medicaid, providers that offer behavioral health services, and these types of things, and just not always getting the healthcare you need when you need it, can really take a toll on long-term health and even sense of well-being. And then when we promote healthcare access throughout the community and not just in our clinics, it really can serve as a prevention strategy, because it puts the services where are more accessible, they're more available, and really helps people be able to have the healthcare that they need and impact and address things like their physical, mental, and behavioral health need. And even when we talk about schools, we talk about unmet needs. Unfortunately, this often can lead to family crises, things like involvement with the child welfare system, lack of school attendance for various reasons, including health reasons, can impact both involvement with the child welfare system as well as impact involvement with the justice system. So supporting families and helping them know how to find healthcare, making it easy to get the healthcare that's needed, both can really help kids be able to be in the classroom and learn and be in class rather than out of school for being sick or having to go to healthcare appointments. And it just really helps to remove barriers to care. Next slide, please. Evelyn, this one's on you.
So this is our big picture slide about healthcare access and quality as it relates to Healthy People 2030. So the goal, as Robert was describing in the previous slide, is really to increase access to comprehensive, high quality healthcare services across the lifespan. So with that, of course, it's for students and families. The scope is really broad when you look at Healthy People 2030 and this healthcare access and quality domain. It has some things that I hadn't really connected the dots that would fall into this social determinants of health bucket. So just sharing that with Healthy People 2030, it looks at things like best practices in prevention and services across holistic health, including medical, behavioral, and dental services, patient-centered, team-based primary care, health insurance, health IT, health communication, and community approaches to meet needs, just like you'll hear about more today.
Next
Next
slide.
slide.
So this is the goals of Healthy People 2030 and the method, which is to promote interventions to increase access to healthcare professionals. And having a healthcare professional in the school would definitely increase access and also improve communication, right? And so this ability to work with families, to work in the community, school-based health centers can really impact that. So some of the relevant school-based health measures that we as a country are trying to improve on as we Healthy People 2030, is our goals for the country across this decade. Things like adolescents who had a prevented healthcare visit in the past year, children with developmental delays who get intervention services, proportion of people who can't get medical care when they need it, right? Helps children get care and even families. Proportion of people with a usual primary care provider, which you often find is kids may not have a primary care provider other than the school-based health center provider. Increased people with health insurance, which I know schools and school-based health centers work on a lot. Dental care, which I'm so excited to see so many people involved with oral health and dental care participating today because that's an incredibly important component. Medical care for kids, dental care for kids, behavioral health care for kids, these are all crucial things. And then increase the proportion of low-income youth who have a preventative dental visit, which is really often done in schools and often very successful there. Please go ahead, Christy. So how does health access and quality impact school success? So a child that's healthy is a better learner. Academic achievement bears a lifetime of benefits for health, right? They kind of interact with each other and they're really important. I always say that nothing belongs in a school that isn't about education. So when you talk about a school-based health center, it is talking about improving at the education of kids by getting their needs met, disrupting the classroom the least. I'm a big fan of the idea that everyone in the school should do what they're best at. When we talk in healthcare, we talk about everybody acting at kind of the highest level of their licensure. So what a nurse can do, a doctor shouldn't do, things like that. And the same thing happens if you're able to meet healthcare needs, then the school nurse can focus on preventive and vaccinations and everything else. The school counselor and the school psychology teacher can be in the classroom teaching students. And those students are able to learn because their needs are being met in a way, because they're having their needs met and able to get the healthcare that they need. So we see from research that higher academic grades are associated with more cumulative and individual health behaviors among high school students. We see things like youth risk behaviors like physical inactivity and unhealthy dietary patterns, tobacco use and alcohol use are linked to poor grades and test scores. So if we can impact these things through the work that we do in schools and through the healthcare initiatives that we do, it really has an impact. Evidence-based, effectively coordinated, strategically planned school health help to close academic achievement gaps and promote health equity across the school. Academic success of youth is strongly linked to their health, and it's one way to predict health outcomes, adult health outcomes, right? So if we have healthy kids, we tend to have healthy adults. And school health programs reduce the prevalence of health risk behaviors. So we do see less risky behaviors when there are access to services, including behavioral health in schools, and a positive impact on academic performance. Next slide, please. So the research says that those students who receive mostly A's versus those who receive mostly D's and F's were more likely to have injected legal drugs, 4 times more likely to have had 4 or more sexual partners, 5 times more likely to miss school because of safety concerns, and 2 times more likely to feel sad or hopeless. So we know that health and health status have a huge correlating effect with academic achievement, both directions. Next slide, please. So school-based clinics, this is general stuff, and we're going to talk about the specifics in just a minute. I know I'm rushing through this and I'm saying a lot, but that's because what Krista and Dr. Correll have to say is so much important than anything I'm saying now. But the Community Preventive Services Task Force, which is part of the U.S. Department of Health and Human Services, it's what can we do to prevent. Really recommends the implementation and maintenance of school-based health centers in low-income communities to improve educational and health outcomes. Some of the educational outcomes that they highlight, so these are proven, the science shows that in school districts, low-income districts that have school-based health centers, you have a better school performance, more students being promoted on time to grades, better high school completion, reduced education gaps between students. Some of the health outcomes you see, students are better vaccinated and they have their other preventive services met. You have lower asthma morbidity, reduced emergency department and hospital admissions, which reduce the cost for healthcare for all of us, and a reduction in health risk behaviors in those students. Next slide, please. So these are just some general ideas of a school-based clinic, and one of the first questions I'm going to ask Dr. Correll in clinic, but some of the general characteristics of school-based health centers include they provide health services to students of all ages through pre-kindergarten through high school. There is parental consent right? Nobody can receive health care when they're below the age of consent without their parents being involved. And they may offer certain types of care or only to certain types of students. Things like reproductive or mental health may have more requirements. They're often recreated in schools that have low-income communities. Services can be done by school staff, may be provided to school staff, student family members, and others. And I'm a big fan of making those services available to staff of the school, because if a teacher can get their health care on their planning period, or they can get their child vaccinated, and they can be in the classroom, those students are going to learn better. They can use a single clinician to provide primary care. They can provide services across medical, dental, and behavioral health, like we see in Coffeyville. Sometimes you have medical centers or healthcare providers outside the school, or most of the time. Community Health Center of Southeast Kansas is an FQHC that partners with the Coffeyville district. And services can be available during some school days or hours, during non-school hours, or kind of all the time. Next slide. So what we're going to look at today is how did a school and community partnership increase healthcare access and quality in one community, right? We're talking in each of these sessions as we go through the social determinants, how school and community partnerships can impact these social determinants and improve educational outcomes. Next slide, please. So now we get to the good stuff. Thank God, because I don't like talking. We get to pass off to Krista Postai, who's the CEO of Community Health Center Southeast Kansas, and Dr. Craig Correll, who's the superintendent of Coffeyville Public Schools. Next slide, please. So I'm going to pass on to Krista. She's going to tell us a little bit about Community Health Center and about their work with school health.
So thank you, guys. And hello to anybody that remembers me. Next slide, please. This first picture is all our locations now, and let me tell you how we got there. We were originally in Pittsburgh, Kansas. Mount Carmel Hospital was established in 1903 to take care of coal miners and their families regardless of ability to pay. Fast forward to 1997, and a partnership was formed between a school district, the university, and the hospital. The first and only time we ever worked together to establish the Family Resource Center, which was designed for early childhood education. We were kind of ahead of our time. What everybody really wanted was quality childcare. We wanted something bigger and better. We started out in a double wide trailer, which is the picture in the right-hand corner. And I remember thinking, because we'd originally been in a classroom on the second floor of Lincoln School, which is where the original center was opened. The school district closed that school and we reopened it 3 months later with 400 kids in childcare. But we were in a second floor classroom because you can't put kids on the second floor. And we thought we had 2 exam rooms. We were just doing immunizations and child checks, because the nurses of USD 250 told us kids were showing up for school without what they needed and they weren't ready to learn. They were getting suspended, so we had 50 or 60 kids at the beginning of the school year who couldn't get into school. So we were basically taking a Can Be Healthy nurse and doing physicals and immunizations. Worked extremely well, but we discovered that children come with adults who have their own complication. Southeast Kansas, as many of you know, is the poorest and least healthy area of Kansas. We die 10 to 15 years younger. About 35% of our kids are in poverty, so we have a lot of challenges. Next slide, please. So we grew from that double wide trailer to the largest health center in Kansas, one of the largest in the country now. We're in the top 50. And to show you where we're at, we go from Lacine, Kansas, outside Kansas City, all the way down to Miami, Oklahoma. The stars are where we have actually real clinics. The jail bars are where we are in jails, and that's a whole nother Zoom I'd be happy to talk to somebody about. The nurses caps are where we have nurses only in the schools. Could be one, can be five. The green ribbons are where we have mental health services. So we have tried, we kept growing, and I will tell you that every day we get a call from people who want or need more. Next slide. So these are the services specifically in the schools that we're offering. We do have 5 full service clinics. Pittsburgh was our first, Coffeyville was our second. We have nursing services, dental outreach, and behavioral health. And so much of what we do started with dental, so I'll be happy to talk more about that. But behavioral health is the #1 request we're getting now. And because of the shortage of health professionals, it's been a challenge to provide it. Next slide, please. So these are all the roles we play in the different in schools. We are a federally qualified health center, so we can bill Medicaid, which we do. We don't. We bill commercial insurance if the kids have it. I can go back to the early days in dental, for instance, and the dental hygienist will remember this perhaps, that you could only go into schools with, and you could only treat low-income kids, middle-income kids. You couldn't even screen. And as a parent, that was very frustrating to me. So we did work with Dr. Weena, who was over the dental program in the state of Kansas, to get the regulations modified. I thought it was insane that we had health professionals, licensed health professionals, who could only treat certain kids. And we were able to advocate for that and get that changed. Next slide, please.
And can I interject? I mean, one of the things that I think is
Please
important
do.
is you believe that the services you provide to the poorest should be just as good and no different than the services that are provided to the very richest and best. I mean, often, I know you often model yourself after Mayo Clinic, for example, but could you talk a little bit about that philosophy?
Well, you know, again, I can go back to the Sisters of St. Joseph, who I worked at the hospital, and they believe that poverty was defined in multiple ways. Poverty can be financial, but in some of our many of our households, single parent households, kids didn't have it, parents worked, couldn't get to the doctor. And so across the board, from the richest to the poorest, every parent had a need. With a few exceptions, we've been accepted by all income levels. And I do believe, especially when it comes to behavioral health and reproductive health, there's a real gap there. A lot of parents aren't comfortable. So we've been able to do that. I think it's a mistake to assume that I found out recently from a 70-year-old man who is gay. He has never been asked about his sexual activity. And he goes to one of the most prominent physicians in town. So I found that there's a huge gap in traditional medicine that school health can fill, because we're comfortable talking about anything and everything. So yes, I agree, especially when it comes to behavioral health. There's opportunities there that some of these kids will never get unless we're there. Anyway, this is what we've done last year or this year in school health. It's not just direct care, and we do a lot of direct care, but it's vision and hearing, all the school requirements we're helping fulfill. And I think the number that really dazzles me is more than 200,000 nurses visits. I had an opportunity to spend a day with the school nurse in Coffeyville before we opened there, and I could not believe the traffic and everything she was doing, from changing diapers to calming down an hysterical teenager. So their opportunity to make a difference is huge. And the last slide. So We did start in USD 250 with a mobile van because they didn't have room. We were fortunate in Coffeyville that their elementary school actually had an existing clinic, and we were able to move into that. We then found some federal grant money to build a freestanding school-based health center at the middle school and high school. And I'm proud to say we've taken care of almost 6,300 children at the Coffeyville School District since 2012 when we originally opened. And I think Dr. Correll can fill in the blanks, but I will tell you that he was instrumental in our opening, and we wouldn't be here today if not for Dr. Correll. Is there anything else I should probably cover, Robert?
No. Oh, I've got lots of questions, and there's lots of questions in the chat. But if we want to go forward, Christy, and then, so one of the things is I wanted to, and Christy did, excuse me, Krista, too many Chris's in the world. Krista did a great job of talking a little bit about community health center. But Dr. Correll, I wonder if you could talk a little bit about, from the school district side, tell us a little bit about kind of the school clinic and kind of how that's been. You've been there since the start. You predate the school clinic, I think, by 3 years in the district. Is that right?
I believe so. 3 or 4, yes.
So tell us about, first of all, why were you interested? And I know even some of your doctoral research relates.
Sure. I'd done some research in my doctoral program and wrote a paper regarding just all services for students and how beneficial they are and how much more beneficial they could be if they were in the schools. That's where most of our students are the majority of their day. And it just makes sense to bring that care into the school. And Krista is very flattering, but we would not be here today without Krista's vision and Dr. Ham, a former board member who recently passed away, who also had a vision for this. And I think the three of us were instrumental in what we've done here in Coffeyville. Obviously, the benefits are students are in school all day, every day, and having access to quality health care is paramount on a daily basis for these students. They're able to walk down to the clinic and receive care, come right back to class. So you can make a direct line toward our absenteeism rates, how much they improved. In the very beginning, we noticed we had a vaccination rate of around, I think it was 11-12% in our district, which just flabbergasted me. And within a year of partnering with CHC, we had that up to almost 100%, and it's stayed there ever since.
Yeah, because you have vaccine for children in the school, right, Krista?
Yes. And then also just some other pieces that are very convenient for students and parents, things like school physicals. When our athletes need physicals, they can run right down and receive a physical. That's never been an issue in Coffeyville, students not having a physical, because it's right there. The services are right there. On an average year, CHC sees about 35,000 visits to the clinics in Coffeyville. We have around 1,800 students. So that means on average, every student is seen about 20 times a year, which is just really incredible. When you look at Coffeyville as being one of the poorest school districts in Southeast Kansas, one of the most diverse student population in Southeast Kansas, and with the inroads that we have made and the healthcare they've received, and it doesn't stop at just healthcare. Dental is offered also. And at first that was screenings turned into fluoride treatments, and we've even done extractions in our clinics. And so many of our students, it's the first time they've ever been to a dentist, and they have that option now to be seen there. Sorry, my mouse is kind of acting funny here.
And I think one of the things that's important is understanding, like, how did this community relationship start? And I know Krista can tell kind of the story of her and Jerry Ham seeing each other and kind of beginning to talk about doing this.
Yeah. The conversation started with those two, came to me, and because of my background in doing some research, I was all in from the very beginning. So we had a lot of conversations about what this could look like. And as Krista alluded to, fortunately, we had a new elementary school built in Coffeyville not too long before this took place, and it was built with a very large clinic for a school nurse. So we had that was existing. So they were able to come in and really do a trial run there to see were they going to get enough students in to make this worth their while. Obviously they did. And then Krista and her folks wrote a federal grant, and we built a clinic on our high school, on our secondary campus for our middle school and our high school. So we have that state-of-the-art building there for all students to be seen.
So what was
Go
important
ahead.
in the beginning? Like, how did you introduce this in the community? What do you think was important to kind of it even starting and being successful in the beginning?
As with any new initiative, it's having those initial conversations and relaying the potential benefits of this partnership. I do believe firmly that partnerships are key to success no matter what we do in life. So it was starting with some community groups, visiting them, and talking with our school board members. And believe it or not, we had a couple of school board members who didn't think this was the best idea. We were a school district. We were about education. We were not about health. Over time, they did all come around. Everyone sees what a great partnership it has been. One thing that's really hard to believe, we had 2 school nurses before CHC had come in, and we are actually spending less per year for the services we have now, which completely, shadow what we had before. I believe we have 10 to 12 staff from CHC in our clinics daily. So because of that partnership, we have so much more access to professionals, to our doctors, our nurses, everyone. And so there's just been a great increase in students being seen, and obviously increases in health, increases in attendance, and just an ease for parents that they know their students can be seen there. They can come home with a prescription that their parent can then run to the local pharmacy and fill. So we've definitely seen a really a boon in our health and our access for students and parents. And
So
I
how do
think
you
you mentioned something earlier, Robert, too, about staff. And I oftentimes forget about this. Many of our staff utilize the clinics too, so they can go down on their break and be seen without having to take off work, which is obviously a benefit for them and a cost savings again for the school district.
Yeah, I'm a big fan of the idea that a teacher belongs in the classroom, right? And if we
Yes.
often the people who get the least health care are our school teachers, and they come to school sick, and they care about their kids, and it's also just, even taking off. I grew up, my mom was a teacher, my dad worked for the government, and I'll tell you that if I was sick or had to go to the doctor, my dad took off because my mom was not dealing with leaving school and having a substitute and all of that for that. That was just so much more important. So I know, and sometimes I get questions, and I think you guys can both provide sort of a good feedback on, like, how do the normal activities, school health activities, the school nurse, the school counselor, school psychologist, how does that interact, or what's important? Kind of how does having school-based health add to that, and how do you coordinate between sort of the school staff that are working on sort of what we think of as routine school things and some of the things that happen with the school-based clinic?
That's really a great question. Before, a lot of this would come to school counselors. Students would come to school counselors and maybe talk about their physical ailments or their mental ailments. And so the school counselors work closely with CHC staff. And then recently, in the last 3 or 4 years, we've hired on CHWs, and they work probably daily with the CHC staff because there's a lot of overlap there. The CHWs are there to work with the students and their families. And so a lot of times they provide transportation for students or for family members to come into the clinic to be seen, because if the family isn't healthy, then that usually impacts the student in some way.
So, Krista, we have a lot of people in today's session who are healthcare providers that may be interested in working with schools districts, or maybe interested in kind of having more successful programs that work with school districts. What do you think is important on the healthcare side, a healthcare entity that's looking at providing school-based services? What do you think the keys are to being successful with that?
Over the last 20 years, it's critical to have champions in the schools. And everywhere we've gone, we've had either a superintendent or a principal that advocated for this. So it's critical that you have a partner in this that also is willing to put children first. I think Dr. Correll will attest to this. When we first arrived in Coffeyville, the traditional medical community did not want us there. Pediatricians sent out letters to all his patients and said, if you go to the school-based health center, don't come here ever again. We had originally went in naively thinking that we could be assistant to the existing providers, critically underserved in this region, and found that they felt like we were interfering with their care. We got calls saying, "Don't immunize my children," and it was nuts. So you have to be eyes wide open and appreciate that not everybody wants you there, but you go where you're invited.
Shoot.
Yep.
Sorry, I did that. I was trying to
Oh.
unmute my. Krista, you're muted. I'm sorry. Can you unmute yourself? Sorry,
Thanks.
guys.
I thought you didn't like what I was saying.
I love it. You know
I
I
thought
do.
but we had to overcome a lot of barriers. So it sounds easy now. It took us a couple years to get acclimated to the schools. You have to also appreciate you're walking into someone else's house, and not everybody's enthused about you being there. In the elementary school, to get to the clinic, you had to walk through administration, and we thought everybody'd be excited about that. People working in administration didn't necessarily enjoy the traffic. So if you put kids first, eventually everyone comes around. So that's what you have to go in with, what the school wants and needs. And every place we've walked in, it's been different things. Again, behavioral health seems to be the priority, but we ran into some politics there as well. So my advice would be, don't be discouraged, and find the folks that understand what you're trying to do and work with them and provide them what they need first, not what you think they need. Because healthcare often thinks we're the smartest ones in the room. I had dental hygienists just showing up when they wanted to and commandeering space, and then complain they didn't like the space. So it did took some work on our side to acclimate our own staff to what it's like to be in someone else's space, and appreciate the fact that schools are very, very overstretched when it comes to staff. They can't just drop things and help you.
Please
Go
go ahead,
ahead.
Dr.
So
Krell.
I was going to say, Craig, you probably have a lot to add to that because you were there.
I would add to that education is extremely important in educating your community. We know that a lot of our students, the majority of our students, weren't being seen by our local hospital. So it really wasn't taking money from our local hospital. Were there some that were seen there? Sure, but a lot of them weren't being seen at all. So it wasn't necessarily taking money from the hospital. And it did take several years of work, but now our local hospital and CHC do work pretty well together. And so when there are referrals at CHC that CRMC, Coffeyville Regional Medical Center, can handle, then they're referred back to the hospital, which is generating more income for the hospital. It also helped that after a year or two that we were in partnership, I ran for the board of directors for the local hospital, and that's helped too. So now I have a foot in both arenas to really help both of these two partners work better together.
So you're almost 15 years into this. How or why does CHC, SEK, and the Coffeyville School District still like each other and how are you working together 15 years down the road?
It's a mutually beneficial partnership, and to me, I knew it would be early on. I know Krista did too, and a lot of people didn't see that. But to me, it was just so obvious early on that this was just a great marriage of two entities. And I've been across the state many times. I'm in my local superintendents association. I've been president of that, and I tell districts all the time, and many times they kind of just look at me with wild eyes, like this couldn't even be possible. But I tell them this is something you really need to do, and you're really ought to check into because it's best for your students and your staff and your community as a whole.
And the data certainly supports it.
Yes.
Everything we do is data driven, and now in 2024 we can actually get timely, real-time data. So we know that we're making a difference, and we can demonstrate that to the rest of the world, and the rest of the state is starting to catch up. 20 years ago, when I called the state of Kansas for support, the school health folks didn't even answer the phone. They're now actually out trying to do this in other places and encouraging others, but you do need a large population to make it cash flow. So rule of thumb is you have to have at least 600 students in one location to justify a full-time nurse practitioner or PA in the facility. And Coffeyville was one of the few schools in Southeast Kansas that had that kind of concentration. The idea of a centralized school was way ahead of its time as well. And you don't see that as often as you should. So it's making it harder. So telehealth is coming in as a factor for those small schools that have 300 and 400 kids in the whole district. We are able now to modify, thanks to technology, our connections with kids. And we can bring in specialists in Coffeyville, psychiatric nurse practitioners make a huge difference when it comes to medication, because there is that a resource is not available in the community. So time has finally caught up with us.
And if
Yeah,
I
go
could
ahead.
piggyback on something here, Krista mentioned real-time data, and it just reminded me of a topic that I hadn't even thought about mentioning here. When COVID hit, the partnership that we have with CHC was paramount in our ability to deal with the situation. And I can easily state that our school district handled COVID better than any school district in the state of Kansas because of that relationship. I also had a relationship with the nurse at our local Montgomery County Health Department. I had a great relationship with her. And so the three of our entities were able to communicate daily. And with real-time data, we had live spreadsheets that all three of us had access to, and our ability to handle COVID. It was never easy. I won't say that, but I hear the horror stories from other districts, daily during COVID, and ours ran so smoothly just because of that pre-existing relationship that we had and our ability to share that data between all three entities.
So I'm going to ask a question, and then we are going to get to all the great questions in the chat. But sort of my final question before we move into these great questions is, and it's one you may not have an answer to. So I know that there are people on the call who have either kind of had efforts for a school clinic that kind of didn't come to fruition, didn't work out, or that may not even know how to start or think about getting school-based health services, either who to work with in a school district or a school district not knowing who to work with as a healthcare partner. What would you say if they're beginning to think about how do we make this successful? How do we try it again if we've tried it before? How do we make it successful if we have something but it's not working great, or we don't even know where to start? Well, are there any suggestions for kind of how to begin to think about figuring out how to do this?
If you've never seen one, I would offer a visit to Coffeyville just to see it firsthand on what the makeup is.
And I would say, you want to start out small, with baby steps before you jump into it. It's expensive and it's challenging consent wise, and if you have a community that isn't 100% in, it takes some time. So start with education. We started with dental screening to begin with. We have a great story behind that. A little boy at Coffeyville, before we were even there, had an abscessed tooth and a fever of 105. They could not find any dentist between here and Pittsburgh, Kansas to see this young boy. And so staff at Coffeyville drove him to Pittsburgh, Kansas, and we extracted this tooth, got his fever down. Within an hour, he was a healthy child again. And it goes back to the time when there was a little boy, I think back east, Damani Driver, that had an abscessed tooth that died as a result. Michael was the little boy that lived. And we recognized, we sent a hygienist into the school, and Michael was not alone. A lot of kids at Coffeyville had dental problems, which at the time was the #1 reason for absenteeism. And nobody would take Medicaid. And we still have that problem in Southeast Kansas among the dental community, which is there are fewer today than there were then. So we started small by going into the school and screening for dental decay and doing sealants and fluoride. And that was our introduction to the community. and we were reimbursed for that. So it was financially feasible. It was a win-win for everybody. So I would say start small and, and then work your way up to Monica Bernan will be on next month. She's the expert when it comes to pro formas and figuring out how to do things. She's the person, Greenbush is the place to go to if you want some background on how to do it. She can help you, or I can help you. Dr. Correll also will be happy to walk people through it.
And I would say visit. If you want to see how how it works, go. And we're fortunate that, Kansas and Missouri, there are lots of school clinics, there's lots of people doing it, and it's a very welcoming environment. We only have about 15 minutes left, because I talk too much. And also these guys have so much amazing things to say. I'm going to let people unmute if they want to say something. We're going to go through the questions. While I wait for someone to unmute, I'm going to go with the first question I see in the chat, which is, Kansas is a state that has passed some laws related to screening and questionnaires and things with students. So how does that impact things like general screenings for things like oral health, or the types of things that you might do for everyone in a school district?
If you want me to take that, I remembered back when I went to school, we had pink cards that said you had to get a dental visit, which I don't think anybody did. State of Kansas does now fund that and support that. So the dental screenings are kind of the front lines that I think, have been more valuable in. Vision and hearing, we also assist the schools with that. So there are lots of opportunities just to go in and be helpful, because you might and often have one school nurse with 600 kids that need to be screened. So Dr. Correll could probably speak to how having that supplemental health has made a difference. That's what got the vaccine rate up.
Sure. And I think also that the early detection and treatment of disease that the students didn't even know that they had. And it's extremely important because a lot of our students were not seen on a regular basis by a primary care physician.
Are there any questions before I ask one more from the chat? All right, well, get ready, guys, and feel free to ask. But Kim Shu asks about, how are you able to encourage children and their families to be comfortable using the clinics? What do you do to make them feel accepted and welcome, and that this is just the place that's theirs?
We have open enrollment. We have 2 days of open enrollment. It's in our big multi-purpose room at our elementary school, and CHC has a table there every year. So as the students are enrolling, that's one of the stations they go through. That way they're able to meet, the nurse or the doctor who was there on site, which I think definitely helps with that. We also have interpreters available. Our ESOL population has really exploded in the last 5 to 7 years. So we have interpreters available as well. So those students can then be seen. So really it's making sure that you pair those people together. So you don't just tell them there's a clinic, you can come see it. You really want them to meet the staff and understand that they are welcome.
And we do more than just medical care. Eligibility assistance is a big one. Years ago, we were able to get presumptive eligibility, which means if you're a child or a pregnant woman, you're immediately covered by Medicaid. Given all the complications we've had in the last couple of years, especially with the unwinding, we can be very helpful to folks and help them navigate systems, which we have staff to do now. Community health workers can take people to places they need to be. We also pick up the phone and always talk to parents. Parents know we're making it convenient to see their child for a sore throat or a headache without them having to take off work and get to us. I think we've created win-wins and wins for everybody, school district, the parents, and the children. Asthma is particularly bad in our school systems. That we can get medicine for people who can't afford it. So it took a couple of years, but I think now staff is well accepted. They're part of the team, and I'm not sure we've had any problems in recent years, except reproductive health always is a challenge. And I would suggest it back to, if you're going to start something, start in the elementary school, less politics.
I'll tell you really quick on asthma that when I ran a school-based health center in Missouri, one of them, asthma inhalers under the federal 340B program that FQHCs have access to were $1.51. So we just started, kids had an asthma inhaler at home, they had one at school because it seems silly to see kids that are suffering and even dying when it cost me $1.51. So we just started giving them out for free. I mean, obviously with a prescription, but there's a lot of really innovative things you can do. So we often struggle in school districts that have high percentage uninsured and especially high percentage ineligible for insurance, such as immigrant populations. How would you suggest to have a successful school health program in a school district like that?
Financially, again, you treat everybody that walks in the door, whether they have coverage or not. I always say if you do the right thing, the money will follow. And we don't make money at school health, but we don't lose money either. So you just have to recognize that a sick child, no matter whether they're eligible for insurance or not, if they walk into an ER, it's going to cost thousands of dollars. If they walk into a school health center, we're talking pennies. So we have been able to get most children eligible for Medicaid or for some other programs. We still struggle, but you just have to do the right thing.
And that philosophy of CHC is the key because that's obviously a school district's philosophy. We don't check your identity when you come to enroll in our school, whether you're a citizen or not. Our job is to educate every single student in Coffeyville. And you walk in the door, we're here to educate you. You walk in the door, and CHC is there to treat your healthcare needs.
So, Dr. Correll, what types of educational outcomes or community outcomes are you seeing from having had the clinic now for over a decade?
That's so hard to factor in when you look at all of the initiatives that we have. But we do know the data supports that the clinics have helped us improve our attendance, which obviously increases your graduation rates. Our graduation rates have been excellent over the last 7 or 8 years. So I think part of that is testament to having the clinic here for as many years as we have. It took a while, but now we are seeing that these students are healthier. They are at school more. Their daily work is better, daily attendance is better, and we're graduating more of those students that are prepared to be prepared for post-secondary success.
So Coffeyville started with K through 6. That's where they put the first clinic. I often recommend that, but the problem, you will see immediately some impacts on things like attendance and behaviors if you're having behavioral health services like therapy. But I always said it's going to take 18 years before we really know what this does in a community because things like your teen pregnancy rate, graduation rates, those all take time. And just having what you need throughout your school and life can really, sometimes it's that lifelong impact that is a little bit harder to measure.
And our teen pregnancy rates have decreased tremendously since CHC has been here. And Krista did bring up the reproductive health. Once you're in a secondary setting, you will. That's the only one issue we've ever had with parents with the clinic. And I say parents, but it was really just around one parent with reproductive
I'll
health.
tell you. So I was the director when it started, and we started and we weren't doing those services. We were in K through 6 anyway. But we started having parents ask for it. And
Yes.
then the big change was there were 2 8th grade girls that got pregnant in 1 year, and we realized we had to do something as a community.
Yes. And I would do it all over again. Everything we have done has been worth everything.
And we did structure things to take this into mind. So in USC 250, the mobile van was actually not in the school, was parked outside. So we didn't have to, the school regulations didn't necessarily apply. Education influence from the Department of Education did not govern what we were doing. In Coffeyville, we actually leased the space we're on. It's a federal clinic. So politically, we are immune from some of the issues that do arise. But I am very proud of the fact our first couple of years, we walked in, there was a refrigerator of breast milk because there were so many students breastfeeding. One, the school is good for letting them continue in school. Some schools don't, but it was disruptive. And we have drastically reduced the teenage pregnancy rate. with some help from the state of Kansas and some funding there.
And I would also
Very
tell
proud of
you,
that.
don't choose a hill to die on, right? You don't have to do everything. If you're welcome into the school to do oral health or mental health or some medical, that's okay. You know, this is not an all or nothing proposition. Krista said that earlier. You know, find those spaces that there's a need that's unmet. If your medical community isn't welcoming, your behavioral health community may not really care, or there may be nobody serving the kids, you know, with therapy or serving them very well. And so, you know, my final say on that is figure out what's most needed in your community and begin to partner on that. So we have just a couple minutes, and so I don't know if anybody wants to unmute and speak up with any final question that they have.
Robert, I'm Melinda Bailey in Fort Scott,
Hi.
Kansas. I would just really like to brag on the community health workers. I've heard people bring up a couple times. Like they have been so instrumental in Fort Scott and the school districts, like the work that they do to help kids, like getting glasses, getting shoes, clothing, housing, beds to sleep in. Like it's been a game changer, and I've really appreciated getting to know the community health workers in Fort Scott.
Well, I'll tell you, the biggest compliment I've ever gotten in my life was when Krista Postai told me she should have thought of that. So I tell everyone that because if you can think of something that Krista hasn't thought of, you are having a sharp day.
And
So-
you know, you just mentioned beds. I had no idea the number of students in Coffeyville that did not have a bed to sleep in, and our CHWs became aware of that quickly, and then found a local town that had a mattress factory who has now donated several beds to Coffeyville students. So, you know, that was just, you think you know everything about your community until you have community health workers, and you realize how much you didn't know about your community and how welcoming the families have been for those CHWs.
And there again, I mean, I guess the thing that I would, and not that I'm a speaker today, but it's just take your time, build trust, build respect. I mean, you know, when people know that you're there to help them and to not judge and to be part of their lives and that you're just there to, you know, be on their side, that really changes everything, whether it's a school clinic or a school community health worker, any type of thing that you want to do to help improve your community. I think we probably need to go on to the next slides. I really want to thank our Krista and Dr. Correll, and I know they're both open to anyone emailing, and you can certainly email us with questions. Christy, can we go to the next slide? So Evelyn, I'll let you talk a little bit about sort of takeaways from today.
For sure. With all this excellent information and inspiration, we're really hoping folks think about how they can put something into practice in their own community and environments. So just a heads up, we'll check in with you in our next session just about things that you've tried and to put into practice and anything that we can all learn together. Next slide.
So these are the key takeaways. I know number 4 is kind of long, but you know, I think it's really important that unmet health needs related to healthcare access really does impact ability of kids to be successful in school. We heard communication's key, being able to be in the same room and continue to talk about things, even the tough stuff, like teen pregnancy and birth control and these types of issues that can often really hurt these types of initiatives. That communication, and especially with parents and in the community, is important. Clearly identify the goals of what you're up to, what you're going to do, where you're going to start, and always communicate, continue to do so, both between the school and the healthcare organization. Know who's responsible. You should have strong support at the leader level, like the superintendent and the CEO, as we had today. But you also should have in each of those organizations someone at that local level that manages it on a daily basis. And then, like you heard from Dr. Correll, when things come up like COVID, you're better going to be able to meet those needs and deal with those issues. Next slide, please. Here's some resources. We'll send those out after. Next slide. So thanks for attending, and I'm going to pass on to Christy to finish this up today.
Great. Thank you, Evelyn and Robert, for sharing with us about healthcare quality and access. And thank you to our featured guests, Dr. Correll and Krista Postai, for sharing about their school clinic partnership. I'm sure we have all learned a lot. And thank you, everyone from the audience, for joining us. We will send the slides and follow-up materials to your email. They'll also be available on the website and Facebook page. The links for those will be in the chat. And then we hope to see you next Thursday at December 12th at 9 o'clock to discuss education quality and access. We hope everyone has a great day.